Hey folks, Scott Raffa here. We're going to talk more about shop talk about terms, medical terms, talk about things we do. One thing is a medical term actually that relates to spinal stenosis. When people have achy legs, achy backs, achy backsides, they can't walk that well. What the heck's going on? And how do we communicate that to a doctor or a clinician? And how do you measure that with what's going on? So, as an educational point, when people have clumping of nerve roots, their spine is compressed, they have stenosis. People get that report all the time on their radiology. They take a look at this. Hey, do I have spinal stenosis? The term we use to describe what the patient's going through, what they feel like, how they move, how they're walking, is neurogenic claudication. Now that's the medical term, neurogenic claudication. So we're going to touch on that. So like I said, that describes everything about the patient clinically, which means personally, how they're moving without any, detective work, no data, no x-rays. You're just watching patients and seeing how they look. So a question is, how do they look? What do they do when they're moving, and what are they struggling with? They often have any of the following. They can't stand upright that well. They're always leaning forward. They have to hunch on things and lean on things to walk further, like a shopping cart. They lean on a shopping cart, they walk farther. Funny enough, that's a term, shopping cart sign. They have achy legs. They have to sit down and take breaks. They stretch out a lot, and they have a lot of heaviness. And when they're walking, they have to really sit down and shake off that achiness in the legs and their feet. All that can kind of subside. There's a wave that goes away, and then they start walking again. So what does that mean on the other half of the equation, which is the stenosis and the radiology, and what do you do about all that? Well, when people have symptomatic spinal stenosis that's often severe, very compressed, which is measurable, we can hopefully talk about that in other details in another video, they are struggling with neurogenic claudication. They claudicate, they have achy legs. It's based on how these nerves are arranged inside of us in the spine. They're in a fluid-filled space, typically ebbing and flowing with all of our motions. They are very electrically active, and when they're compressed, they get squeezed and really strangulated almost, and they can't breathe electrically. They have a blockage of sorts of electricity that make those legs start to generate symptoms. And thus we call that term, when we look at patients and discuss what is the clinical word that summarizes everything, they're claudicating. They have neurogenic claudication. And that really summarizes 10 different thoughts in our heads. When you go talk to a doc and say, hey, this is what's going on, it summarizes quite nicely. So that's what that means to me. Neurogenic claudication really tied closely together with symptomatic spinal stenosis, often severe spinal stenosis in caliber, which we'll touch on later on about some of those details. Talk to you soon.